As men age, it's natural to notice certain physical changes, but some of them can make us feel uncomfortable, worried, and even frustrated. In today's video, we will address common issues that men face after the age of 70, such as decreased firmness, sensitivity, and even changes in size. But don't worry, we will also share effective and safe solutions to help you maintain your vitality and confidence. Why watch until the end? This video not only identifies these changes, but also offers practical and applicable advice to help you manage them. You will learn how to face these natural transformations and restore your intimacy with simple lifestyle tips and techniques. If you're ready to take control of your health and live a full and active life at any age, you want to stay with us to discover all the valuable information we share today. If you haven't subscribed yet, please subscribe and activate the notification bell so you don't miss any videos. Your support means a lot to me. And if you enjoyed this video, you can help me continue spreading these valuable tips by giving it a like and sharing it. In this video, I will reveal alternatives that are not only safe but truly effective in helping you strengthen your erections and preserve your intimate health in a lasting way. These solutions are not just a way to maintain your virility, but also play an essential role in allowing you to live a fulfilling, satisfying, and active sex life. I deeply believe that good intimate health is key to satisfying relationships and personal well-being, and I want to share these tips with you, which I hope will bring renewal and new energy to your daily life. Before continuing, I warmly invite you to subscribe to our channel. Every video we share is designed to provide you with valuable information about sexuality and relationships. These topics are intimate and human, and we treat them with great passion to offer enriching and inspiring content. If you found this video helpful and truly value what we share, don't hesitate to give it a like. This greatly helps us reach more people who, like you, are looking for concrete and benevolent solutions. And of course, if the content has touched you, leave a comment. Write 1 if you were interested in this topic, or 0 if you think there is still room for improvement. Your feedback is essential for us, as it allows us to grow together and offer even more relevant content. First change: excess skin. As we age, especially after 70, our bodies undergo natural, inevitable, but deeply human transformations. One of the first things that becomes evident is excess skin on the penis. This doesn't happen suddenly, but gradually, and it's crucial to understand that it's part of the natural aging process. Over the years, the skin loses its elasticity and its ability to stretch and return to its original state. This phenomenon results from the decrease in essential substances like collagen and elastin, which play a fundamental role in maintaining the firmness and elasticity of the skin. Previously tighter, the skin of the penis may now appear looser. This can confuse some men, as the appearance of this sagging skin might, at first glance, resemble phimosis, a condition where the foreskin cannot retract completely. But it's vital to understand that this situation has nothing to do with phimosis. It's simply the body changing over time, losing its natural elasticity, nothing more. This loss of firmness is not exclusive to the penis. It also affects other parts of the body. The face, neck, hands, all these areas lose their tone, become more flabby and less resilient, a consequence of the passing years. The penis, being a naturally tight area, can make this change more visible, but it's a perfectly normal phenomenon. We must accept that our bodies transform, and sometimes this transformation can unsettle us. This aesthetic change, though completely natural, can cause some discomfort, especially when we're not prepared for such physical modifications. However, it's crucial to remember that these signs of aging are not defects or failures. They reflect the beauty of time, the life that passes, the accumulated experiences, and the lessons learned. The loss of skin elasticity, though it may seem surprising or uncomfortable, generally does not affect sexual function or the ability to have erections. Of course, a bit more care and hygiene may be necessary to avoid irritation or discomfort, but this should not be a cause for stress or anxiety. If this change becomes a real bother, there are solutions to restore skin elasticity, such as specialized creams or treatments, which can provide relief. However, what many men discover over time is that aging is not something to fight against. It's a process to be accepted with love and kindness towards oneself. Some choose to embrace this transformation, seeing it as an integral part of their life story. Every wrinkle, every sagging skin, every change is a page turned in our journey. Accepting this is freeing oneself from the perfection expectations imposed by society and recognizing that each stage of our life has its beauty. Sexuality, even as we age, can be full, meaningful, and connected. That's why I created the digital book Rediscovering Intimacy, Healthy Sexuality After 60, which offers practical tips and solutions to help reignite passion, strengthen relationships, and overcome emotional and physical challenges. This book is an invitation to transform and enrich your love life, to rediscover dimensions of intimacy that are just waiting to be experienced. I invite you to get your copy by clicking the link in the pinned comment. This opportunity could be the first step towards a love life full of rediscoveries and satisfaction, no matter your age. Second change, loss of elasticity. As the years go by, our bodies undergo inevitable transformations, and one of the most evident is manifested through the skin, especially that of the penis, which progressively loses its natural elasticity. This is a reality many men encounter as they age. In fact, over time, essential substances like collagen and elastin, which provide firmness and flexibility to the skin, decrease. During youth, the skin of the penis can easily stretch and regain its original shape after an erection, offering a sense of firmness and robustness. However, with age, this ability to relax and return to the initial state naturally diminishes. This phenomenon, though entirely natural, can generate a noticeable change. During an erection, some men notice that their penis seems less firm than before, and to the touch, it may even feel different. This difference can cause some discomfort or concern, although the function of the penis, in terms of the ability to have an erection, generally remains intact. It's important to note this. Although the appearance and sensation have changed, this does not mean a loss of sexual performance. On the contrary, the internal tissues like the skin also lose some of their elasticity, which explains why the rigidity, which was more pronounced before, may seem less marked with age. This can be frustrating for some men, as not only during an erection can the firmness be less noticeable, but even at rest, the skin of the penis appears looser, less tense than before. However, it's essential to understand that this phenomenon is part of the natural aging process and does not affect the ability to have sexual relations or experience pleasure at all. The physical changes that accompany age are inevitable, but that doesn't mean we have to resign ourselves to a less fulfilling intimate life. For those who feel uncomfortable with these transformations, there are available solutions, such as creams or therapies that stimulate collagen production and can improve skin elasticity. However, many men choose to accept these changes over time, seeing them as part of the human experience, of this incredible adventure that is life. It is an act of wisdom to accept that, just as we change in other aspects of our existence, our bodies also evolve, and each stage of aging tells a story of experiences and accumulated wisdom. In the end, although rigidity and firmness are no longer the same as in youth, it's important to remember that sexual function, pleasure, and the ability to connect intimately with a partner do not depend on these changes. In reality, These transformations can become an opportunity to rediscover sexuality from a different, more mature, and more satisfying perspective. Thus, although the body changes, the very essence of human connection remains intact, and that is what makes intimate life even more beautiful and meaningful as we age. Third change, reduction in size and thickness. Over the years, it's quite common for many men to notice subtle changes in the size and thickness of their penis. While this may surprise some, it's a completely natural process related to aging. This phenomenon is mainly due to a gradual decrease in blood circulation, a crucial factor in maintaining sexual health and function. Over time, blood flow to the penis can become less efficient, which can lead to changes in how it responds to arousal. The arteries that carry blood to this area may narrow, often due to the accumulation of fat in their walls. This narrowing hinders blood circulation, which in turn affects the penis's ability to fill during an erection. As a result, many men feel that their erections are less full and that their penis seems smaller, both in size and thickness. Although this change is entirely normal and part of aging, it can be destabilizing for some, especially when not well understood. Another important factor to consider is the state of the internal tissues of the penis, especially the corpora cavernosa, the structures that allow maintaining firmness during an erection. With less efficient blood circulation, these tissues no longer fill as well as before, which can reduce the firmness and thickness of the penis during arousal. It's essential to remember that this does not indicate a serious problem, but is a natural consequence of aging. It doesn't mean that sexual function is compromised, but rather that the body is experiencing transformations that can be accepted with serenity. Fortunately, there are ways to minimize the effects of this apparent reduction in size and firmness. Adopting a healthy lifestyle is one of the keys to preserving vascular health and maintaining good blood circulation. A balanced diet, rich in fruits, vegetables, and foods that promote blood circulation, plays a crucial role in this process. Foods rich in antioxidants, essential fatty acids, and vitamins help nourish blood vessels and improve their flexibility, which can help counteract the effects of aging. Additionally, regular exercise is essential to maintain good blood flow and improve cardiovascular health. Physical activities like walking, swimming, or cycling help strengthen the heart and stimulate blood circulation, not only for overall well-being, but also for better sexual performance. It's also important to avoid harmful habits like smoking and excessive alcohol consumption. Tobacco, especially, is an enemy of blood circulation, as it damages blood vessels and prevents blood from circulating properly. Similarly, alcohol, when consumed excessively, can have similar effects, decreasing the quality of erections and exacerbating the perception of this size reduction. In the end, although these changes are inevitable, they should not be seen as insurmountable obstacles. On the contrary, accepting these transformations and taking steps to support our physical and emotional health allows us to continue leading a fulfilling and satisfying intimate life. Aging is not a burden, but a stage of life that, with the right decisions, can still offer many enriching experiences, both personally and intimately. If you're still watching this video and find these lessons useful, please comment the number 1 below to let me know you're still watching this video with me. Fourth change, less visible penis. Over the years, our bodies undergo profound changes, and one of the most common phenomena is what is known as a hidden penis. This transformation, though entirely natural, can confuse some men who notice an apparent reduction in the size of their penis, especially when at rest. This phenomenon is primarily due to the accumulation of fat in the pubic area, just above the penis, as well as the progressive relaxation of the scrotum. As age progresses, fat around this area slowly develops, creating a layer that partially covers the penis and gives the illusion that it is smaller and less visible. Alongside this fat accumulation, the skin of the scrotum also loses firmness over time. The scrotum, which plays a key role in keeping the testicles in a more elevated and tense position, naturally relaxes as the years go by. This loss of tonicity accentuates the feeling of the penis being retracted, giving this area a less toned and more flabby appearance. The combined effect of fat accumulation and scrotum relaxation can create an appearance of penis size reduction, an experience that some men find frustrating or discouraging. It's important to highlight that these physical changes, though concerning for some, are a normal part of the aging process. They are not a sign of declining sexual function, nor an indication of a serious medical problem. However, for those who feel uncomfortable with this phenomenon and wish to restore the appearance of their body, there are several available options. One of these solutions is cosmetic surgery, such as liposuction in the pubic region, which allows for the removal of excess fat and makes the penis more visible. This procedure can offer an effective solution for those looking to regain a body image more aligned with their expectations and feel more comfortable in their skin. In addition to this option, there are also treatments specifically designed to improve scrotal firmness. These procedures, often non-invasive, aim to tone the skin and slightly lift the scrotum, contributing to a more natural and less retracted appearance of the penis. This can provide men with greater confidence in their bodies and allow them to feel better in their skin, both aesthetically and functionally. This aging process can be difficult to accept for some, especially if it affects body image. However, it's important to remember that every physical transformation, whether in the penis or other parts of the body, is part of a broader story, the story of life itself. With the right information, a healthy lifestyle, and modern available options, it's entirely possible to adapt to these changes and maintain a fulfilling and satisfying intimate life. The beauty of aging lies in the ability to understand and accept these changes while exploring solutions that help us feel good in our bodies at any age. Fifth change, penile calcification. Over the years, the body undergoes natural transformations, and one of the conditions that can appear with age is penile calcification, a phenomenon more common in older men. This process is often associated with Penile disease, a condition where hardened plaques form within the penis, specifically in the corpora cavernosa, the essential structures that facilitate an erection. These plaques result from chronic inflammation in the region, a phenomenon that develops slowly over time. In the case of Penile disease, this persistent inflammation leads to the accumulation of calcium and the formation of scar tissue in the penis. These hardened areas create rigid zones that alter the natural flexibility of the penis. This can cause a curvature of the penis, especially during erections, which can be not only uncomfortable, but sometimes painful for some men. The rigidity caused by these calcified plaques limits the normal expansion of the corpora cavernosa during an erection, which can lead to decreased firmness and make achieving a complete erection more difficult. This deformation of the penis, though often invisible at rest, becomes especially evident during arousal, which can affect the quality of sexual relationships and cause emotional distress in affected men. The corpora cavernosa, responsible for blood filling and penile rigidity during erections, function normally by filling with blood. However, when they are restricted by hardened plaques, this capacity for expansion is severely limited. This results not only in less firm erections, but also in a visible deformation that can be embarrassing and disturbing. It's important to note that Penile disease is not the only cause of penile calcification. Other factors, such as repeated trauma to the genital area, can also contribute to this condition. Minor injuries caused by intense physical activities or even excessive tension during sexual relations can, over time, leave scars that can harden and form calcified plaques. For men suffering from this condition, It's crucial to consult a doctor to evaluate the situation. Treatments depend on the severity of the disease and its impact on daily life. In mild cases, anti-inflammatory medications may be prescribed to reduce inflammation and improve the flexibility of the affected tissues. These medications can help prevent the condition from worsening and alleviate discomfort. However, in more severe cases, where the penile curvature is significant or causes substantial pain, surgical intervention may be considered. The goal of surgery is to remove the calcified plaques and, in some cases, correct the penile curvature, providing relief to the affected man. Although Peyronie's disease and penile calcification can be sources of frustration and embarrassment, it's essential to understand that these conditions are part of the many transformations the body undergoes with age. Fortunately, medical advances offer treatment options that allow those who suffer from them to regain a satisfactory quality of life. The key lies in seeking appropriate medical care and being open to solutions that, although they may require time and patience, can significantly help improve the situation. Sixth change: reduction in natural lubrication. Over the years, many men notice that their penis doesn't stay as hydrated as before. This phenomenon may seem subtle at first, but becomes increasingly evident with age. The skin of the penis, like the rest of the body, loses its ability to retain moisture and maintain its elasticity. This process is due to a decrease in the production of natural substances, such as sebum and oils that help keep the skin flexible and hydrated. As we age, this loss of hydration becomes more pronounced, making the skin drier and less flexible than before. With this decrease in natural moisture, the penis can feel drier during sexual intercourse. This lack of lubrication, though common, can increase friction, which can be not only uncomfortable but also irritating to the skin. The more intense the friction, the higher the risk of skin irritation, making the sexual experience less enjoyable. But dryness doesn't only affect physical comfort. It can also interfere with the quality of the erection. Dry and less flexible skin can limit the penis's ability to move freely, hindering the intimate experience and reducing pleasure for both partners. Although this change is natural, there are effective solutions to address it and improve comfort. One of the simplest and most practical options is the use of lubricants. In particular, water-based lubricants are highly recommended. They are gentle, non-irritating, and act quickly to reduce friction. This makes sexual intercourse much more comfortable and enjoyable while protecting the skin from irritation. Additionally, regular use of lubricants can help maintain a smoother experience, reducing the risks of pain or discomfort. Besides lubricants, specific moisturizers for the genital area can also be an ideal solution. These products are formulated to restore moisture, relieve dryness, and deeply nourish the skin. It's important to choose gentle products, free of fragrances or irritating substances, to avoid additional discomfort. These specific care products not only treat dryness, but also keep the skin flexible and healthy in the long term, promoting more enjoyable relationships and better overall comfort. It's essential to care for the body, especially the sensitive skin of the penis, as we age. Instead of considering dryness as inevitable, simple solutions can be adopted to improve comfort and maintain a fulfilling intimate life. By taking care of this delicate area with the right products, it's possible to continue fully enjoying sexuality, even with the changes that time may bring. The key is to pay attention to the body's signals and take appropriate measures to maintain a satisfactory quality of life, both physically and emotionally. Seventh change: appearance of spots. As age progresses, it's completely normal to notice that the skin of the penis, like other parts of the body, begins to show color changes and spots. These marks, though natural, can be disconcerting as they appear while the skin undergoes the effects of aging. The aging process not only affects the appearance of the skin, but also its ability to regenerate and maintain an even texture. Over the years, the production of collagen and elastin, those essential proteins that ensure the firmness and elasticity of the skin, significantly decreases. Without this structural support, the skin loses its resilience and starts to show irregularities, such as darker spots due to excess melanin or, conversely, lighter areas due to reduced pigmentation. This phenomenon is a natural part of aging, but is not only caused by the body's internal processes. External factors like sun exposure, pollution, and even hormonal changes also play an important role in the appearance of these spots. Although the skin of the penis is generally less exposed to the sun, it's not uncommon for internal influences, such as hormonal fluctuations or less efficient blood circulation, to favor the appearance of visible marks. This phenomenon can be even more pronounced with age, when the skin becomes more fragile and less capable of defending itself against external aggressions. In the vast majority of cases, these spots are benign and do not pose a health risk. However, it's important to stay alert. If sudden changes occur accompanied by symptoms like itching, pain, or inflammation, it's crucial to consult a doctor. Although these spots are generally harmless, some could indicate underlying skin issues, such as infections or specific conditions that require medical treatment. Taking care of the skin, especially in sensitive areas, becomes even more crucial as we age. To maintain healthy skin and reduce the appearance of these spots, hydration plays a fundamental role. The use of gentle moisturizing creams or lotions, specially formulated for sensitive skin, is recommended. Avoiding irritating or harsh products can prevent the condition from worsening and help restore more even-toned skin. Additionally, it's important to protect the skin from external factors that can damage it, such as pollution, extreme temperatures, or chemicals. These care routines, besides helping to keep the skin softer and more hydrated, can also minimize the appearance of spots and improve the overall appearance of the skin. Although aging and the accompanying skin changes are part of our life experience, it's possible to take measures to preserve skin health and feel good about your body at any age. Accepting these transformations while taking care of oneself allows for maintaining a satisfying, intimate life without being affected by the effects of time. 8th change, small cracks. As we age, our bodies undergo inevitable changes, and this includes the skin of the penis, which gradually becomes drier and less flexible. This increased dryness can lead to the appearance of small cracks or fissures, a phenomenon that can be both uncomfortable and concerning. Over time, the skin loses its ability to retain moisture and maintain its flexibility, becoming more fragile, vulnerable, and less resistant to external aggressions. It's as if little by little, our body loses that wonderful natural care ability it had in the past, and this change can make us feel more fragile and more aware of our vulnerability. The production of sebum, that precious substance that keeps our skin soft and hydrated, decreases with age, exacerbating skin dryness. This loss of hydration isn't limited to appearance. It deeply affects comfort, especially during moments of friction or pressure, such as during sexual intercourse. It's an often ignored reality, but has a considerable impact on our intimate well-being. Imagine that skin, which was once flexible and smooth, becoming rough, less able to adapt to the needs of our body. This dryness can cause small cracks, which, although they may seem insignificant at first glance, can cause pain and discomfort when they extend, such as during an erection or intimate contact. If you're still watching this video and find these lessons useful, please comment the number 2 below to let me know you're still watching this video with me. The fact that these cracks can cause physical discomfort and even pain only increases the frustration of losing a part of the quality of our sexual life. Pain, whether mild or more intense, can affect not only our pleasure, but also our self-confidence and overall well-being. And that's not all. These small cracks, no matter how harmless they may seem, are open doors to germs and bacteria. This exposes us to a higher risk of infections, a complication that everyone would want to avoid, especially when it affects such a sensitive area. This is why it's essential to take care of this delicate skin. Keeping the skin hydrated and in good condition is not just a matter of appearance, but of comfort and protection. It's about preserving our well-being, maintaining our vitality, and not allowing these physical changes to negatively affect our quality of life. For ourselves, our partners, and our health, taking the necessary measures to prevent these cracks and maintain good hygiene is an act of love and respect towards our bodies, a gesture that shows how much we care about preserving what makes us whole and complete. Ninth change: reduction in penis length with age. As age progresses, some men may notice a subtle, yet sometimes concerning change in the appearance of their penis. It may seem smaller than before, and while this is natural, it can provoke feelings of frustration and unease. This phenomenon is due to a series of factors that, over time, become increasingly noticeable. Blood circulation in the genital area, essential for a complete and satisfying erection, can gradually decrease. When this circulation is reduced, the penis may have difficulty fully expanding, giving the sensation that its size has decreased. This can create a feeling of emotional discomfort, loss of virility, and affect self-confidence. Another important factor to consider is the accumulation of fat in the pubic area. As the body ages and accumulates more fat, especially in this specific area, part of the penis may become hidden under that additional layer, reducing its visibility. This can give the impression that the penis is smaller, although, in reality, it remains the same size, only concealed by the surrounding fat. This phenomenon becomes especially visible in individuals who gain weight over the years and can lead to a loss of self-confidence, especially in intimate moments. In addition to these factors, there are internal changes in the structure of the penis that contribute to this sensation of reduction. Penile tissue, over time, can become less elastic and lose volume. The very structure that allows the penis to appear full and vigorous can change, resulting in a less full and even more flaccid appearance. It's a change that is part of the natural aging process but can be difficult to accept for many, as it touches on one's self-image and perception of masculinity. However, it's important to remember that these changes are not inevitable, and there are ways to mitigate them. Managing weight by maintaining a balanced diet and a healthy lifestyle is essential to limit fat accumulation in the pubic area. By reducing this fat, it's possible to give the region a more defined appearance and make the penis more visible. Additionally, regular physical exercise is fundamental to maintaining good blood circulation, which directly impacts erectile function. Finally, we should not neglect the pelvic muscles. Performing specific exercises to strengthen these muscles, such as Kegel exercises, can improve sexual health, promote better blood circulation, and support erectile function, thereby offering greater satisfaction and self-confidence. These changes are part of life's journey, and it's crucial to accept them with wisdom while taking the necessary steps to preserve good health and full sexual function. Aging can bring challenges, but there are solutions to minimize these effects, and above all, it's essential to remember that each stage of life can be full of beauty, pleasure, and satisfaction, as long as we take care of ourselves with love and respect. 10th change: reduction in sensitivity. Over the years, it's completely normal for many men to notice a decrease in the sensitivity of the penis. This phenomenon can be even more pronounced in those who suffer from chronic conditions such as high blood pressure or diabetes. These diseases can have a direct impact on blood circulation and nerves, two essential factors for optimal sexual function, thereby reducing the body's response to stimuli. High blood pressure, for example, can damage blood vessels, hindering blood circulation to the penis and making a complete and firm erection difficult. This lack of blood circulation also impairs the rapid response to stimuli, which can decrease sensitivity and arousal. In the case of diabetes, the situation can be even more complex. Elevated blood sugar levels can damage nerves, a phenomenon known as diabetic neuropathy, which affects not only sensation in the hands or feet, but also in more intimate areas of the body, such as the penis. This loss of sensation can make sexual relations less enjoyable, reducing pleasure and affecting the intensity of the experience. When sensitivity decreases, reaching orgasm often becomes more difficult, directly impacting the quality of sexual life. But it's not only the physical dimension that is affected, as this loss of pleasure can generate emotional discomfort and affect self-esteem. Feeling less sensitive and less reactive during relations can create feelings of frustration and even shame, deeply affecting self-confidence and overall well-being. However, it's important to remember that these changes, although natural, can be mitigated with appropriate care. Managing conditions like high blood pressure and diabetes is essential to preserve good blood circulation and nerve health. For example, taking prescribed medications, following specific treatments, and adopting diabetes management strategies can help reduce the impact of neuropathy and improve erectile function. Consulting a healthcare professional can also allow for finding personalized solutions, such as physical therapies or medications, that help restore greater sensitivity and, therefore, improve the quality of sexual life. Although aging inevitably brings physical changes, there are many ways to maintain the health and appearance of the penis and preserve self-confidence. Taking care of the body overall is essential. Regular exercise, following a balanced diet, and effectively managing stress can make a considerable difference. These lifestyle decisions not only help reduce the signs of aging, but also maintain better sexual function, thereby contributing to a more satisfying and healthy life. I would like to hear your thoughts on this topic. Which changes have been the most impactful for you? Or have you noticed similar effects in your own life? Don't hesitate to share your experiences or reflections in the comments below. As we conclude today's discussion, I hope you have gained valuable information about the changes that naturally occur in the body with age, especially regarding sensitivity, circulation, and the impact of chronic diseases. It's important to understand that while these changes are part of life, there are ways to manage them and continue living a full and healthy life. From managing conditions like high blood pressure and diabetes, to taking care of your body through exercise and a balanced diet, every step counts in maintaining not only good physical health, but also emotional well-being. So, what have you learned today? What has impacted you the most? And how will you apply it in your life? I would love to hear your thoughts. Feel free to share them in the comments below. If you enjoyed this video, leave your comment below and don't forget to like, share, and subscribe to our YouTube channel to stay informed about upcoming interesting content. Thank you for watching, and remember, taking care of yourself is one of the best things you can do for your future.